Well, here we are again. The galahs, no, not me, the galahs are in the trees, although you may disagree with that, but the real galahs are in the trees. The sun's kind of breaking through the clouds, the water's lapping the shores, trees are up there in the lake. So what are we going to look at today, or discuss today? I want to look at the concept of health, us being the victims of our own success. Now, irrespective of whether you believe people have souls or not, or you go to another planet or another world when you die, the fact is that we're flesh, bone and blood. We are an exceptionally delicate organism in a hostile environment. And the history of the human race, irrespective of who we are and our cultural backgrounds and our religious backgrounds, has for thousands of years been a struggle against death. Not just death at the hands of our neighbours or a neighbouring community, but death as a consequence of disease. And human history is littered with examples of civilizations that have disappeared almost overnight because of disease. Now, in Australia, through struggle, and that's the key word, through struggle, we have created a health system which, although it has some flaws, is an exceptionally useful one when you compare it to most other health systems around the world. And this has come through struggle, through people struggling for better health care, for a better public health system, for better access to pharmaceuticals, through vaccination, through sewerage, and the list goes on and on. Up till the 1880s, in Melbourne and other urban centres around Australia, up to 50% of children under 5 would die before they reach the age of 5, mainly through communicable diseases and diseases due to lack of sewerage. And it's quite interesting that in Victoria, when the sewerage system was dug throughout Melbourne, that the mortality rate amongst children under 5 dropped from about 50% to about 10%. Just that one thing had a profound impact on children surviving. Also, we've been very successful since 1975 because of continuing struggle by trade unionists and other community and social activists to improve access to the health system. And we have, since 1974, a universal healthcare system, which means it doesn't matter who you are, how old you are, how rich you are, how poor you are, you do have access, especially in emergency situations, to a public health system, which is free. And if you have chronic diseases, there are many structures in place which again have come through struggle, and the last one, which came about in the last few years, is the National Disability Insurance Scheme for people with disabilities, a pharmaceutical scheme which sees the government helping to cover the costs of pharmaceuticals, and an excellent acute medical care facility in the public hospital sector where people can be airlifted from place to place, from place of accidents to a major teaching hospital, and have the necessary treatment and surgery. All at no cost, and that's the key, at no cost. Just to give you an example, a businessman from New South Wales found himself in the USA in 2020. He contracted COVID-19. He was in hospital for 5 months. He died in a US hospital. His family has just been sent a bill of $11 million. They don't have a universal healthcare system. And as far as access to pharmaceuticals is concerned, because of government subsidy of pharmaceuticals, everybody, especially people on healthcare cards and disability support pensions and other social security cards, have access to pharmaceuticals at a fraction of the cost. Now, the negatives have been the fact that we privatised the Commonwealth Serum Laboratory, CSL, and CSL was formed in 1911 by the federal government in order to provide vaccines for all Australians. It was privatised in the mid-1990s by the Paul Keating-led Labor Party. That means we no longer have manufacturing capabilities as far as vaccines are concerned, and more importantly, although we have research facilities in various universities, we don't have a centralised, publicly funded vaccine research and manufacturing sector. At the same time, we've seen creeping privatisation of the public health sector, which again has a lot of negative connotations as far as delivery of health care is concerned. So what's the issue? The issue is very simple. We have been exceptionally successful. I'm old enough to remember when diphtheria was a problem, when whooping cough was a problem, when measles was a problem, when mumps was a problem, when polio was a problem. And all these diseases have been, the effects of these diseases have been grossly minimised through vaccination. That's right, vaccination, that evil word, vaccination. We don't have cholera in this country, we don't have typhoid, we don't have polio, we don't have smallpox, we don't have much whooping cough, we don't have much diphtheria, we don't have much measles, much mumps. The list goes on and on and on. Because of successful vaccination programs which have given children immunity and given us as a society herd immunity. I remember going to school in the 1950s, you never knew as a small child whether you'd come home and have contracted polio and die or sustain some severe disability for the rest of your life. And I remember the banks of iron lungs which were in a lot of peripheral hospitals where people who'd survived the polio epidemic who couldn't breathe were basically stuck in these iron lungs for 20, 30, 40, even 50 years. So vaccination has been exceptionally successful in this country. Public health care has been exceptionally successful. The fact access to pharmaceuticals has been exceptionally successful. Now these haven't occurred because governments have given them to us, they've occurred because of struggle. And we have lost them, like we've lost the Commonwealth Serum Laboratory, because we weren't willing to stand up and fight. And we find ourselves in this ridiculous situation during the COVID-19 pandemic, where government response has been, at the state and federal level, has been particularly inefficient in many regards, because we no longer have a social and preventative healthcare sector. The public sector is basically, as far as healthcare is concerned, has basically become a mechanism via which contracts are given out to private providers, as we've seen with the COVID-19 pandemic. And we see that we have to negotiate with private corporations for access to vaccines because there is no manufacturing capability in this country publicly. So these are the issues. So because of these successful healthcare initiatives, we have a number of issues now. We have an increasingly aged population, an aged population with multiple health issues, which to a significant degree are symptoms of the type of lifestyle, sedentary lifestyle we have. So we have large numbers of people in our society with type 2 diabetes, large number of people who are obese. We have a large number of people with health issues like cardiac issues, arthritic issues, dementia, and the list goes on and on. As the population lives longer, and the average age for men and women, that's non-Indigenous men and women, is around 80 and 80 plus, while for Indigenous men and women it's just under 70. We find that we have an aged care sector which is grossly underfunded and cannot provide adequate aged care to an ageing population. we have a public health system which has been overwhelmed, not just by COVID-19 patients, but has been overwhelmed by the number of elderly people who require urgent or semi-urgent medical attention. We've now got the ridiculous situation that unless you're critically ill, that you may have to wait years before you can obtain a elective surgery in the public sector. Now obviously people with disposable income can buy private insurance, and what private insurance does basically gives you the convenience, because you've got the money, of having your surgical intervention or medical intervention much quicker in a private sector. But as far as life-saving technology is concerned, there's only a few private hospitals which can provide the service, and even they cannot match the service which is provided by a public health sector, which is geared to deal with acute emergencies. And we find that basically the private health sector cherry picks the less complex medical and surgical issues, makes a buck out of it, and leaves the more complex issues, both private and public, to the public sector. At the same time, we find, because of the lack of competition among pharmaceutical corporations, the amount of resources, taxpayers' resources that go into the pharmaceutical benefit scheme increase, because we don't actually have a pharmaceutical manufacturing industry which is publicly owned. So this is another problem. So there are issues, but the latest issue, which is quite extraordinary, is this resistance. The latest issue is this community resistance to vaccination to the COVID-19 pandemic. If we exclude those people who think it's a pandemic, or who think that COVID-19 doesn't exist, or who think Bill Gates is trying to inject microchips into the world, and that's an exceptionally small, minuscule amount of people, there is a small percentage of people who find it really difficult to accept vaccination as protection against a pandemic in COVID-19. Although there is a lot of misinformation about, and although the corporate-owned media and the government-gelded ABC to a lesser extent have been responsible for allowing this misinformation to gather pace, especially when it came to the AstraZeneca vaccination for COVID-19, there is still 10 to 20% of the population who are hesitant about vaccination. Now, the irony is that almost 99.9% of these people who are hesitant to vaccination have been vaccinated as children, and they get vaccinated when they go overseas. They've had vaccination against measles, mumps, smallpox, diphtheria, typhoid, poliomyelitis, and the list goes on and on and on. So is this hesitancy due to a large degree to the fact that we have been so successful with sewage disposal and vaccination? Because these two aspects of public health care have saved countless lives, and Australians are no longer familiar with death resulting from infectious diseases, apart from a few antibiotic resistance infections which occur around the country. So we have no memory. This is a society that moves from day to day to day to day, that doesn't look back, that doesn't understand that the healthcare initiatives which we have today are a consequence of the struggle of tens of thousands, if not hundreds of thousands of men and women in this country. They have no idea of that history. They have no idea of the history of vaccination. They have no idea of the damage which is caused in unvaccinated populations by invisible enemies, by viruses that you can't see, you can't touch, you can't smell, who don't respect sovereign borders, who have no interest in your ethnicity or your race, the language you speak, or your religious belief. And it's been vaccination which has made a tremendous difference to the lives of people. It means that people don't need to have 10 children in order to ensure that 4 or 5 or 2 or 3 survive. That most couples these days in this country have 1 or 2 or possibly 3 children. Large families don't exist. There's no necessity for large families because of the lack of death amongst infants. This is a population that seems to have forgotten the benefits of public health. And to a significant degree, this has occurred because of the privatisation of large sections of the public health system, especially social and preventative medicine in this country. And if there's one good thing that will come out of the COVID-19 pandemic, it's one, the struggle to create an Australian serum laboratory to produce local vaccinations and do local research. The struggle to ensure that funds go to the public health sector, not only to provide emergency care, but to ensure that elective surgery is done in a reasonable time frame. The struggle to ensure that the National Disability Insurance Scheme continues to function despite it being pillaged by a private sector which sees it as a direct road to the Federal Treasury. The survival and extension of the universal health system, Medicare, through telephone consultations for general practitioners and specialists. The survival, the expansion of what's left of the community social and preventative medicine. Each health department should have a social and preventative medicine arm which receives adequate funding to ensure that the diseases of the 21st century, the diseases which are due to our success in dealing with health, are adequately dealt with. Things like obesity, type 2 diabetes, cardiac disease, strokes, and the list goes on and on. Without a social and preventative arm to the public health sector, we will find that the inaccuracies and the mistakes which have been made during this pandemic will be repeated ad nauseum. So ultimately, we are a victim of our own success. We are a victim of historical amnesia. That historical amnesia begins when the first colonists put a foot on this continent. It continues today because we refuse to acknowledge the past, whether it was the violent dispossession of this country's original inhabitants, whether it was the struggles which were needed to ensure that we had an adequate healthcare system. So ultimately, the type of society we live in, the type of healthcare we have, the type of access we have, and the expansion of various aspects of the healthcare sector will ultimately depend on people like you. Whether you join public interest before corporate interest is not the relevant issue. The relevant issue is that you demand a strong social and preventative public health sector. You demand a publicly owned pharmaceutical industry. You demand a publicly owned Australian serum laboratory. You demand that the National Disability Insurance Scheme continues to expand. You demand that elective surgery occur in a reasonable time frame. If we leave it to the private sector, we will find the same piecemeal approach that we currently have in this country. We need competition between the public and private health sector, allowing the private healthcare sector in the aged care industry, in healthcare, to dominate the provision of services is a recipe for future disasters.